The World Health Organization (WHO) report shows that large population of Nigerians have various degrees of mental disorder. WHO data revealed that about 18% of the people move about with mental disorder without knowing or seeking for help. These are doctors from primary health care centers in Lagos. They gathered here to be told the best way to help patients with mental disorder recover in no time. Medical professionals were on ground to review cases of mental challenges ranging from simple minor mood disorder to extreme cases of mental accreditation and depression. Dr. Tolu Ajomole works for the Lagos State Ministry of Health Mental Health Desk.
Mental health is a critical component of healthcare, and for the longest time it has been neglected. We realize and understand that a lot of people moving around in Lagos especially suffer from one kind of mental illness or the other. And we understand also that it is difficult for a lot of them to access care. Now we know that mental health has a lot of stigma attached to it. So the Lagos State government has a mental health policy in place which helps to, first of all, create awareness about mental health, reduce stigma in terms of mental illness, but also to educate and to train primary care workers to be able to offer first-line care for people suffering from mental illness or mental disorders.
In the words of Dr. Ajayemi Tunde, who works with the Lagos State Primary Health Board, no one is immune to mental illness.
Nobody is immune to mental illness. And from the WHO record, we know that about 350 million people have mental illness, especially living with depression. It is important to know that in this environment, when we have a lot of risk factors that can predispose a lot of people to mental illness, and most importantly, depression that we are discussing today, which we are focusing on, we must take active measure to address it because of the other side effects and complications that can result in, which could affect physical activities, it could affect other chronic illnesses, and can also cause other medical illnesses in the body.
This is Abiodun Adewuya, professor of psychiatry with the Lagos State Ministry of Health. He's a distinguished psychiatrist with special interest in perinatal mental health.
To train our doctors, nurses, both in general hospitals and in primary health care centers, to recognize common mental disorders like anxiety and depression, and of course we are going to add epilepsy later. And what we are trying to do is to make sure that they recognize these illnesses, they're able to offer some kind of treatment, and they're able to refer to the tertiary centers when need be. When we do this, we are going to make sure that many people who are ill, who are mentally ill, get treated in such a way that they can go back to their work and they can be functional and be useful to society.
It's important as a doctor to be able to identify these cases, because most of these patients come to the primary health care first before they go to secondary health care, because primary health care is affordable and it's easily accessible. So they come, complaints, and if doctors and nurses that are well trained identify these common symptoms and core symptoms that could tilt them to depression and other mental illness, we quickly identify them, give them psychotherapy, and we'll be able to refer cases that will need to be referred to specialists.
For Dr. Dolapo Fashawe, a director with the Lagos State Ministry of Health and Mental Health Desk Officer, mental disorders can be prevented if only medical officers know what to do.
Making mental health and health generally a thing that is not out of reach anymore. Every citizen of Lagos State has a primary health care in his or her locality. It's affordable, it's equally, there's equity in the distribution of health. A person with mental illness can hold a position if and only if this illness is recognized, treated, managed, and followed up with adequate counseling. Our hospitals are being refurbished, they're being rehabilitated, they're being equipped, and even our doctors are being continuously trained and armed with what they need to give and to make healthcare a thing for all.
Despite the challenges of large populations placing demand on Lagos doctors, she believes most mental and behavioral disorders can be successfully treated. However, financial inability of patients is another problem hindering quick treatment.
In a developing nation like ours, the demand on doctors outweigh the supply of doctors. It is very difficult to give qualitative health care in a situation where the patient has no paying power. And that is why the Lagos State government is working very hard to make sure the health insurance scheme is something that is real in the very near future, whereby a patient, as long as you're a citizen of Lagos State, as long as you pay your tax, you are able to access health care. A major challenge is the economy, as it is difficult for people to buy food, as it is difficult for them to pay for services. It is also becoming increasingly difficult for them to pay for health care. But we are hopeful that this government will make that a thing of the past.
For these doctors, mental illness is not a death sentence, but a medical condition that can be prevented and treated with no threat to life as long as patients are available for doctors to do their job.